Over the last 4 days, we have averaged 567 new cases per day. This is a large and troubling number, one that drives home the challenge that we are facing. Breaking it down by day, on Friday we identified 581 new cases of COVID-19, while our lab conducted more than 13,100 tests. On Saturday, we completed more than 13,000 tests and identified 525 new cases. On Sunday, we diagnosed 592 cases and almost 11,300 tests. And yesterday, the lab conducted more than 8,400 tests and identified 570 new cases. Our lab positivity rate in the province has risen to 6.8% yesterday, and in Edmonton, the positivity rate is almost 9%. In Calgary, the growth rate is still high, with an R value of 1.2 over the past 5 days. And Calgary has caught up to Edmonton, with both cities having more than 2,500 active cases each. This is not good news. This is a problem. Of all the developments that have happened since Friday, the one thing that shows some promise is that Edmonton has reached an R value of 1 over the past 5 days, showing that the measures have had some effect. It is a good start, but it is not enough yet. While COVID has consumed much of our attention in our lives, we must not forget that babies are still being born, accidents are still occurring, and Albertans continue to experience a wide range of urgent health needs. Our top priority is protecting the health system to ensure that COVID-19 does not threaten our ability to provide the essential care that Albertans require for all their health issues. Currently, there are 167 people in hospital in Alberta, including 27 in intensive care with COVID. This is a sharp and concerning increase. As you know, many non-urgent surgeries have been postponed in Edmonton zone. We are working with AHS to closely monitor the health system's capacity and, if needed, to consider steps to ensure the health system is able to support Albertans. Sadly, I must report that there have been 15 deaths from COVID since Friday. This is a heartbreaking number that underscores the seriousness of the pandemic. Turning to schools, as of today, AHS has confirmed that 173 schools that previously had alerts have had no transmission, and students and staff are now back in class. There are active alerts or outbreaks in 252 schools. That is about 10% of all the schools in the province. Currently, these schools have 778 active cases in total. This number includes 117 schools that are on outbreaks, including 50 currently on the watch list. So far, in-school transmission has likely occurred in 99 schools. Of these, 56 have had only one new case occur as a result. I have said before that cases we are seeing in schools, as well as in our hospitals and continuing care facilities, are largely a reflection of the transmission that is going on in our communities. As the case numbers reported over the last few weeks show, we are facing a concerning situation, and we need to reduce the rate of transmission if we want to avoid more difficult choices in the future. It is now flu season, and I have heard some people recently dismiss COVID as no different from influenza. While there are some similarities, I want to stress the differences between them and the challenges that each of them presents to us. First, there is no vaccine for COVID-19, unlike influenza. Second, this virus is more deadly than influenza, especially seasonal influenza. While the true mortality of COVID-19 will take some time to fully understand, the preliminary data is clear. In the last 4 influenza seasons, the peak number of deaths we have recorded in a full year is 92. In just 8 months, there have been 338 deaths from COVID-19, despite taking extraordinary measures to contain transmission. This is not to minimize the impact of influenza or the importance of getting your flu shot, which I am strongly recommending. But it is important to highlight that we cannot treat this virus as something that our health system can easily absorb or something that will simply depart when spring arrives.